infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, the restrictions put in place and the resulting social isolation from the COVID-19 pandemic has taken a toll on children's mental and behavioral health. Well, joining me today to take a look at children's mental health during this pandemic is Dr. Mamilda Robinson. Dr. Robinson is a specialty director and clinical instructor of psychiatric and mental health at Rutgers School of Nursing. Dr. Robinson, welcome to the show, ma'am.
Thank you, Robert. Thank you for having me.
You bet. Well, experts have been warning of the stresses on children for some time now. It's been something they've been looking at for some time. Dr. Robinson, what changes have you seen in behavioral and physical health of children since the start of this pandemic?
Well, Robert, some of the trends that we have been noticing are increased anxiety, depression, self-injurious behaviors, even with substance use, and things of that nature.
Okay, and is this affecting children across all age groups equally, or is it affecting others more than other ages?
So children in the younger age groups, such as school age and preschool age children, you tend to see more regression in those children, such as maybe bedwetting or regressive behaviors in children that were perhaps gaining independence that are now reverting to doing things that they would have done at a younger stage. Children that are older, or teens and adolescents, if I may say, may exhibit behaviors such as isolation or just acting differently, not doing things that they used to do before, sometimes even being withdrawn from their peers or parents.
Mm-hmm. Now, one of the most tragic things that come out of this are the suicides. And Dr. Robinson, how many suicides and suicide attempts in children, how is this increased, or how's it being affected during this pandemic? What have we seen?
Well, what we've seen during these times is an increase in mention of suicidal behaviors as well as acts of self-harm. And unfortunately, at times, some of those acts, when carried out, may or can result in a death of those individuals. And this is what has been seen. And more information about this statistics can be obtained from the CDC website. In addition, I believe there's also a toolkit on parental guide to help on how to deal with it.
Yeah, and different states have had different protocols, and they treated the pandemic differently. So are we seeing a difference in suicides in children, in anxiety and depression, a difference between the states? Is there any data for that?
Yeah, all of this data can be obtained on CDC, whereby there's been some vital statistics up to, I don't know specifically if it's current, but I know the last ones that we've seen from, I think, up to about 2018 or so, there was a trend in an increase with regards to suicide.
Mm-hmm. Now, there's been a lot of debate concerning getting children back to school. Dr. Robinson, besides so many of the other benefits, wouldn't this alleviate the anxiety, the depression, and the other mental health issues, or is it not that simple?
Well, Robert, that's easier said than done. Being a parent myself, this would seem like the best resolution ever. However, it's not that simple. There's a lot that is being done currently, and there's still much more to be done. So we have to just be patient and wait till measures are put in place to be able to get children back into school and get everyone socializing again.
Mm-hmm. When should parents seek behavioral health assistance for their child? What steps should they take?
Well, parents should start seeking behavioral health when they're noticing a change. No one knows their child better than the parent of that child or the primary caregiver or caretaker of the child. So when you start seeing, for example, a change in young children, regressive behaviors, like I mentioned before, such as bedwetting, clinginess to the parents, or increased crying. And for older children, when you start noticing poor school performance, loss of pleasure in activities that they once enjoyed before, difficulty concentrating, irritable, lashing out. Maybe the child start complaining about headaches and stomach aches more frequently. Parents should start noticing that. And again, with adolescents, you want to be able to seek help when you notice agitation or behaviors that are showing that they're starting to withdraw from their family or peers. Any type of substance use or abuse that you're noticing, parents need to start seeking seeking care, looking out for interventions at that time. And the best way to do it first is maybe by following up with the PCP or the behavioral health provider to talk about these issues.
Right. And can any of these different issues that you've discussed, are there any specific medical treatments for any of these?
Yes. So once a parent starts noticing changes in your child, of course, the first thing you want to do is talk to the child and find out what is going on. And typically you want to start with non-pharmacological interventions if the child is not in danger to themselves or others. And when I say child, I'm speaking for both children and adolescents, by the way. So if the child or adolescent is not in danger to themselves or others, you want to start with non-pharmacological interventions. Perhaps you can engage them in diversional activities such as art therapy, walking, reading, listening to music, exercise, journal writing to be able to express their feelings. Children that are more anxious can begin with a regular routine. They need to have a healthy diet. You want to promote sufficient sleep and things of that nature. Now, you can also combine this with psychotherapy if just those interventions by themselves are not effective. So the children can see a provider such as a psychiatric or mental health provider or a therapist that will be able to provide them psychotherapy to talk and provide them skills to cope with some of these circumstances. The last resort, if none of these are effective, then they can see a behavioral health provider that can initiate pharmacotherapy combined with psychotherapy and some of the other interventions that were previously mentioned.
Right. Let me go ahead and close out with this. Dr. Robinson, where do you think this is headed? Do you see it getting better, getting worse? What are your thoughts?
Well, it appears that we may be progressing in an upward trend. There are a lot of measures being put in place. Currently now we have a vaccine available, which is excellent, and various resources are being put in place to support children's return to school. There are also other measures, including that are in place now to help children and adolescents, such as telehealth visits, to provide a convenient way for children to receive safe and effective care, so that their parents are able to still provide them care while they're also working remotely or while the child is not able to get to a provider physically. So it looks like, it may be a long haul, but I think we're progressing in an upward trend overall.
Well, good. That's very encouraging. And I want to thank you, Dr. Mamilda Robinson, for sharing your time and expertise with us today. I appreciate it, ma'am.
And thank you again for having me, Robert.
Yes, ma'am.